In 2003, Jessie Stone was kayaking the White Nile in Uganda when 2 members of her expedition contracted serious cases of malaria. This is when she became aware of the devastating effects the disease had on local communities. The next year, Jessie founded Soft Power Health to provide malaria education, prevention, and control for the people of Uganda. Dr. Stone, thank you so much for being here with us today.
Thank you for having me. It's great to be here.
So how does an extreme kayaker turn into a malaria educator?
Not on purpose, I can tell you that. Really, in this case, it was the luck of being in kayaking on this incredible river and then having to deal with a problem firsthand and then sort of asking a larger question. Wow, it's affecting people who have ready access to prevention and mosquito nets, those kind of things, and they still got malaria. So what happens to the local people here? You know, how do they deal with this problem?
Mm-hmm.
Interesting.
So, okay, break it down for us. On a day-to-day basis, you're going into these rural communities, and what are you teaching people?
So, as of now, we have the Malaria Education and Prevention Program that you mentioned to begin with. We have a family planning outreach program where it follows the same model as the malaria program. It's focused on educating people about family planning and then how they can control the size of their family if they want to. And then we help them do that. We give them access to the means of contraception that they may need or want. And so we have actually a very scheduled format to do that. We don't just kind of show up. So we work in villages where we mobilize ahead of time, you know, and we go to these communities and we say, we're going to be here on Tuesday at 3 o'clock. You know, please let everybody who's interested know. And then we arrive with teams of our educators and nurses and things like that who do the education either for malaria or for family planning. And then after the educational session is over, then we go ahead and either sell mosquito nets to people or administer different methods of contraception in the field.
So with the nets, why do you sell the nets rather than give them away for free?
Oh, that's an excellent question. There's a big push you may have heard of, you know, sort of worldwide, because malaria is one of the biggest infectious disease killers, to make sure everybody sleeps under a net. And so the automatic thinking is, well, if you just give them a net, then they're going to use it. But it's much more complicated than that. So not only do people need the education about how and why to use the net and who should be sleeping under the net first, but they also have to have a buy-in to this. They have to have ownership of this whole process. And if we have found through, you know, selling over 50,000 mosquito nets and making follow-up visits to people's homes to see the net in action, that people who have, you know, purchased the net and paid a little something for it actually really take ownership of this process. They're invested in the net, they're invested in the education, they value it. And so whereas if you compare that to a lot of programs where nets have just been given away and then you try to do some follow-up on those nets, the nets are never accounted for. And very often the nets are either under somebody's bed not being used, or someone has actually flipped the net to get money for it so they can use it instead to buy food or whatever. So the net actually never ends up doing what it's supposed to be doing for people.
And what success have you had?
Well, to date, we've sold over 50,000 mosquito nets. We've followed up on probably 10 to 12,000 mosquito nets. And what we've seen after visiting people at home and looking at their mosquito nets and talking to them is that 65 to 70% use the nets appropriately and correctly and report having less malaria. So that's really a good statistic.
Great. You came to this country to kayak, right?
Yep.
So tell us a bit about that, what that's like.
Oh, well, I mean, the Nile has some of the best play boating, freestyle kayaking in the world. It's big, friendly, warm water. You know,
it's a pretty great backyard, huh?
It's a fantastic backyard. I feel very spoiled because where I live, I can, you know, walk to the river within 2 minutes, and then in 10 minutes, I can walk to our clinic. So it's kind of ideal location.
So what's a bigger thrill for you? You know, riding these Class 5 rapids, or, you know, being able to educate folks on how to make themselves healthier?
I wouldn't say it's an either or. They're additive. You know, it's sort of like, for me, that completes my life. I mean, I love the kayaking for a different reason than, you know, I love being able to work in the medical field and do the medical work that I'm able to do there. obviously the whitewater is a, moment-to-moment exciting, all about testing yourself and your skills, and it is also something you can share with other kayakers and takes you to an amazing location. The fact that you can get in a kayak, you see things you never would otherwise be able to see, and experience the, intimacies and intricacies of this huge river, basically. It's very spectacular and fun. And the medical work also brings you into a whole different environment that you would never otherwise see, and with very, very little, you can really help people to help themselves. And in the case of Soft Power Health, we're providing a service that was otherwise not available. So it's very gratifying to be able to see, that with this service, you can help save lives and also help people, again, to learn how to take better care of themselves and their families, so. I don't want to be the person who's just, responsible for making them better. I want them to be able to take care of themselves,
Well, you're doing some great work out there, so thank you so much.
Thank you.
Combining sport, medicine, and giving back to the local community, so thank you.
you.
You're watching Outside Today, only on Outside Television, America's active lifestyle leader.